Edo, 11 in Oyo, 6 in Bauchi, 5 each in Akwa Ibom and Kaduna, 4 in Ogun, 2 each in Enugu, Ekiti, Kwara, and River states, and 1 each in Benue, Delta, Katsina, and Ondo states. The spike in Osun is linked to the arrival of Nigerians to that state from ECOWAS countries. Several groups of Nigerians have made similar intentions known to return. Those discharged from treatment are 44, 7 of which are from the University of Abuja Teaching Hospital Center. We unfortunately have 6 coronavirus-related fatalities in total. There are presently 204 active cases of COVID-19 in Nigeria. The Director General of NCDC will give further details in this regard. We have 9 laboratories for testing as at today for COVID-19 to be augmented over time by other laboratories in the public and private sector. The visit yesterday of the Presidential Task Force to Lagos affirmed the great work Lagos State Government is doing to enhance preparedness and response in the state. We are sure other state governors shall prepare in the same way with infection control, compliant isolation centers, and aggressive community surveillance. Lagos University Teaching Hospital commenced operation of a 60-bed isolation center 2 days ago, having received the COVID-19 starter packs and trained health workers. As the global community commemorated World Health Day yesterday, I thank our health workers for their commitment, hard work, and sacrifice in the response to this pandemic that has drastically changed the pace and style of life. Through training, provision of guidelines, and personal protective equipment, we continue to enhance the understanding and capacity of our frontline workers for this novel disease. I urge all health workers to apply infection prevention and control protocols always and maintain a high index of suspicion for COVID-19. The resources on NCDC COVID-19 website, covid19.ncdc.gov.ng, including national case definition guidelines, are being constantly updated. To health workers, I say, your well-being is a priority to us, and we cannot thank you enough for the work that you do in protecting the health of Nigerians. I want to strongly advise citizens against giving false information of symptoms or travel history to healthcare workers when seeking care at this critical time. It's important for me to emphasize this because we've had quite a number of cases where people deliberately chose not to reveal their travel history. And the implication is grave. in terms of case management. Doing so puts the health of health professionals at risk of infection and also deprives them of comprehensive information to properly diagnose and manage illnesses. Those who tested positive for COVID-19 must report to designated treatment centers for safe isolation and care. Even if they feel well, because the danger of this disease is that those who do not have any symptoms are still as infectious as those with symptoms and need to be isolated for the sake of their families, friends, and the public at large. Health facilities, both public and private, are called upon not to reject patients without giving them advisory on what to do, but to follow NCDC guidelines and refer suspect cases to COVID-19 test sites. In all cases, essential health service is to be rendered, including emergencies, since the arrival of coronavirus does not mean disappearance of other diseases. Additionally, all health facilities are reminded that coronavirus is an extremely dangerous pathogen which spreads very easily. It is not advisable to accept persons suspected of such infection for treatment if the facility is not so accredited. What is meant in this regard is that we're not just relying on public health institutions. We have started the process of accreditation for private hospitals where we are able to establish that they have the facilities for infection prevention and control. And of course, the necessary personnel are on ground. Health workers and other patients and visitors will otherwise be put at great risk. We're engaging the Association of General and Private Medical Practitioners of Nigeria and the Guild of Medical Directors to adequately So when you read from some of these devices and you have a number coming in to disrupt, that's why at times the hard copy would be a better thing to do. But then, the health sector must not lose the gains we have made in the last few years as we combat COVID-19. But continue to support our health workers at all levels. I must highlight the generosity of individuals, groups, corporate organizations, public and private, who have made donations and offered support in various ways to the national response. Donors include health sector associations like the Pharmaceutical Association of Nigeria, JUHESU, and both Nigerian and foreign businesses, civil society, organizations, bilateral and multilateral partners, and foreign governments. Thank you very much.
Chair, honorable ministers, gentlemen and ladies of the press. Today, I'll just follow up on what the Honorable Minister of State has said and really comment on the work our healthcare workers are doing across the country. Yesterday was the World Health Day 2020. April 7th is marked every year. It's also the day that the World Health Organization was founded. The theme this year is Support Nurses and Midwives, acknowledging the role that nurses and midwives play in our world to keep us safe, and particularly during this outbreak, during this pandemic. No one is more at risk than those with the closest contact to our patients. And those really are our healthcare workers, and particularly our nurses. So yesterday, when we went round with the Presidential Task Force around the healthcare facilities in Lagos provided for care, I took out a few minutes at the back to speak to our healthcare workers, to ask them how they were doing, how they felt, if they felt supported. Most of them, yes, are tired. They're working very hard, but they're working very hard for all of us to keep us safe. How has NCDC supported and the federal government supported healthcare workers across the country? As at the 5th of April, we had trained a total of 3,808 healthcare workers on infection prevention and control. 50% of those actually work in the private sector because many Nigerians receive care from the private sector. So as we responded to Lagos and Ogun in the early days of the outbreak, we actually focused a lot on the private sector in addition to the healthcare facilities where we're managing these patients. Another 22% were in treatment centers, and 27% were other members of our health workforce that work as part of response teams. We have trained a total of 270 healthcare workers in each state on case management specifically. We have also trained in every state, the state epidemiologist, state DSNO, and the public health team, trained them how to develop an incident action plan. They've all gone ahead to develop this for their own states, and it's with these plans that they're now managing the response in their states. These trainings have built capacity among our healthcare workers, not only for this outbreak, which is absolutely critically needed, but also for the future. Those of you that remember Mr. President's speech also will remember that he outlined this as one of his key priorities, asking us to train a couple of colleagues from every state to own the response in their state and then train others, in addition with colleagues from the armed forces. This training is being put together at the moment and will be delivered over the next week. For every aspect of this response, we have developed guidance to guide our healthcare workers, made sure that they have guidance on how to put on PPEs, how to take them off, how to clean the healthcare environments that they work in, how to conduct safe burials, how to use a case definition, and an interim guidance on case management, which evolves rapidly. So these are all resources that we have provided for our healthcare workers so that they feel confident in managing a new disease. When you have a new disease, there's no history to reach out to. There's no consultant that will give you all the information. All this has to be learned, interpreted, and put into our context fairly quickly. In addition, we have distributed all the IPC commodities that they have needed. There hasn't been a single stock out of IPC commodities required to manage healthcare workers since the beginning, manage patients, since the beginning of this outbreak. Healthcare workers are absolute priority. If we lose their confidence, we lose the response. So whatever we're doing, we're focused at making sure that our healthcare workers feel confident, feel supported, and we provide them both proactively in terms of the starter packs, but also once there's a new patient, a new case in a state, just like in Katsina yesterday, and in Kwara, and in Delta states, we then provide an extra support, extra delivery, depending on the number of patients, and we try and keep that supply chain well-fueled despite the shutdowns across the country. In addition, we have a small team that is providing off-site technical support. So if doctors somewhere are managing their first cases, they have someone they can call. How do I do this? How do I do that? All that service is provided regularly through the support that we're providing. We're now planning to engage with the professional associations, the Nigerian Medical Association, Association of Resident Doctors of Nigeria, the Medical and Dental Council, the Nurses Organization, the Medical Lab Scientists Association of Nigeria, to make sure all the professional groups are well integrated into our thinking about the response. So I want to end by saying we really appreciate all the work our healthcare workers are doing across the country. But I also want to appreciate their families, because their families are really those that will worry the most every time the nurse goes out or the doctor goes out to work in the morning, whether they'll come back with something home. So they really need the support of their families. And I really want to commend all the families out there that provide the psychological and mental support to their partners, their children, their parents that go out every morning to work in healthcare facilities. They don't have the option of working from home. They don't have the option of not going to work. They have to go to work. And we, on behalf of all Nigerians, are grateful to them, grateful to their families, and on behalf of the Presidential Task Force, we say thank you very much on this day that we're celebrating the World Health Day, despite the challenges that we face as a country. Thank you very much.
Chairman, honorable ministers, members of the Presidential Task Force, gentlemen and ladies of the press, good afternoon. My own contribution will be brief today. First of all, as the chair initially said, we visited Lagos yesterday and saw the isolation facilities. I would like to, on behalf of the PTF, continue to encourage our states to please be ready by providing isolation facilities in case the numbers start going up in your relevant states. We need to be absolutely ready. We also need to seize this particular point in time to make sure that we strengthen our health systems, we improve our health infrastructure, we make sure that our manpower is adequate, and we also make sure that our healthcare workers are trained and protected. In this regard, I would like to again announce that the task force is working to ensure adequate health insurance is provided to all health workers on the front line, working with the Federal Ministry of Health. And we'll also be reaching out to the state ministries of health to see what sort of arrangement can be provided during the COVID period. In this regard, we're also committed in protecting the health of our staff by making sure PPE is available to every healthcare worker, as well as adequate training in terms of infection prevention control. From the point of view of testing, which continues to be extremely important, I would like to ask all healthcare institutions, both public and private, to please look out for patients presenting with unusual respiratory tract infections, especially severe respiratory tract infections that cannot be explained, because this is an important indicator now for testing for coronavirus infection. More and more of our cases are now community linked. We are having fewer and fewer cases that are linked to travel abroad or contact with people who have been abroad. So our healthcare services need to look out for this alert. At the same time, I would also like to encourage the public, those that have suspicion that they may have symptoms related to coronavirus, not to be afraid, but to seek testing as well as treatment. In the vast majority of cases, more than at least 80% of cases of coronavirus infection, most people will have mild to moderate symptoms and will be well. But in a small minority of cases, particularly those that are susceptible or at high risk for severe illness, such as those with underlying medical conditions, and those that are immunosuppressed, for instance, or those that are elderly above the age of 60, 70, particularly 70 years, they could end up with very severe disease. So please do not be afraid to test for coronavirus. Do not be afraid to seek medical attention. For the press, I would like to again emphasize the need for journalists to be sensitive to the myriad of fake news that's going around during this pandemic. Journalists must ensure that news stories and sources are verified before disseminating to the public. We need to avoid the spread of fear propaganda. We need to assure the public. We need to make sure that we are responsible when it comes to disseminating information related to this pandemic. I would also like to charge residents within Abuja, Lagos, and Ogun to please continue to cooperate with us by staying at home. We are still in the early stages of the epidemic. We must remember that the incubation period of the disease can be up to 14 days. This is the time period between when somebody catches the virus and when you begin to display symptoms. Therefore, we must really be mindful of not getting too complacent in our efforts to control the spread of this disease in our country. Finally, may I still continue to plead to the public to be patient with us. We know that the restrictions put in place are hugely inconvenient, but from a public health perspective, one of the most effective ways of cutting transmission is to keep away from each other. Let's please remember we are only as strong as our weakest link, and we must work together to control the spread of this disease. Thank you.
Thank you very much. We will now take reports from ministers, beginning with the Minister of Foreign Affairs, followed by the Minister of Aviation, and thereafter the Minister of Environment.
Thank you very much. Just a briefing on some of our engagements with foreign countries in this whole context. There was a doctor that was part of the team that was caught outside the country, and he made his way to Benin Republic, and we were able to engage with the government of the Republic of Benin, and they gave him safe passage through, and he came into the country yesterday. We also have had 67 Nigerians, including children, men and women. They were in Côte d'Ivoire, and so we needed to engage with the governments of Togo and the government of Benin for them to be able to go through. And they are now at the Nigerian border, and we got the authorization for them to come into the country. And they will be in isolation for the mandatory 14 days once they have come in. We have another 24 Nigerians in Togo in a hotel, and they're going to be tested. And we've also got the government of Benin's approval for them to also move through Beninois territory to come into Nigeria, so possibly by tomorrow. We've arranged also to where they will all be confined when they come into the country. So that's been going very smoothly, and for this we're extremely grateful to the governments of Togo and the governments of Benin Republic who have really cooperated with us and made this possible. With regards to the question of evacuation, I think maybe just also make it clear that the Presidential Task Force, under the chairmanship of the SGF, the Secretary to the Government, had actually been engaging with this question right from the beginning, right from when there was a closure of the airport. So it was not, the response is not as a result of letters or whatever that have been coming in from Nigerians in the diaspora, as has been mentioned in some media houses, but actually something that was taken up by the task force right from the very beginning. But of course, at that time, we did not have all our isolation centers in place and all the other logistical arrangements in place. So for that reason, We kept it in abeyance while we were putting all those things in place, and hence now that we have sufficient beds and so forth, and the protocol is now well established, we now feel in a much stronger and better position to undertake this Herculean task of trying to see how we can bring Nigerians outside the country back into the country. And in that context, we've now started to get greater numbers of Nigerians, especially in the United States, where almost 200 have now indicated willingness to return. We're engaging with our embassies in China and our High Commission in London and also in France to work out all the logistics, but things are now beginning to fall in place and we're getting a sense of what needs to be done. What is important, I think, to get out there to all the Nigerians is that their engagement and communication should be with the embassies, the high commissions, and not with any other parallel agency, department of government, or anything like that. So it should be channeled through them because it is with them that we're, collating the names and making all the arrangements. So that's, I think, very important to get across. And hopefully, we'll be able to kick the process in as soon as possible. So thank you very much.
Mr. Chairman, distinguished ladies and gentlemen, and my friends, gentlemen of the media, good afternoon to you. After the last address here, I spoke in Hausa, and I was called upon to do so by the leave of the task force under the able leadership of the Secretary of the Government of the Federation. And it was a target audience because of certain concerns. And as you see, the practice is that some spoke in Igbo, some in Yoruba. And I was asked to speak in Hausa. Mine caused some ripples, and there are some effects after that. So just to try to put it in perspective on what happened that day, to explain, there's quite a few things. One, there was reports reaching us that some people think that if they bath with salt or they grind into powder duam palm, which is called goriba in Hausa, when they grind it into powder and drink it, it will suffice and it will cure them from coronavirus. And I've been asked to explain why that is false. And I said it's pure science and technology. And science is factual, and that they should please kindly take to the advice by health experts. That is staying safe. And the thing about contagious disease, as explained by experts, is if I have it, may God forbid, I will infect the next guy and the next guy. And the only way that we can all stay safe is by following those protocols established by health experts. And another thing that came to us was that some people said if you open the Quran, the Holy Quran in chapter 2, which is the longest or the biggest chapter in the Quran, that right in the middle you will see a hair thread in it, a black one. Take it and soak it in water and drink it and you'll be cured of coronavirus. And I said that that can only be false, because once you remove hair from where it comes from, it becomes filthy. And I don't think that filthy stuff should be associated with the Book of Allah. And I said also that is false. And I said also there is an established protocol in Islam that if there is pandemic, you remain where you are. You don't get out of it, you remain there until Allah cures it. And if you're outside of it, don't get in there. Simpliciter. And that is what we've been addressing so far. And also I explained in Hausa what social distancing is. And I said it was Zaman Kuda da Buzuzu, meaning that there's a fly and there's a beetle. And they use it in Hausa saying to say that everybody should stay where he is and don't touch each other. when we were kids and we were playing, once they announce, everybody collects himself and stay where he is, and you don't touch each other. So it's the only way that I can explain what social distancing is all about at that time. And so we said that we encourage that you must listen to the health professionals. They are the experts. They know how to advise us best. And once we listen, we will stay all safe. And finally, also to say that we are not able in the Ministry of Civil Aviation to give blanket approvals for flights in and out of the country. You must specify which flight, for which purpose, from which airport, at what time, if it is cargo, what is the content of the cargo you are bringing in, and all other protocols established by Ministry of Health must be observed. If you come in with a crew, we must quarantine that crew, and that function is ceded to Port Health, NCDC, and Ministry of Health. So in aviation, we must comply because we provide the infrastructure for which all of these agencies play. That is the airport. And so we try to keep you all safe. And this is what transpired that day. And I hope this explanation in English suffice. Even though distinguished Senator my brother Shola Ade did a good job on social media trying to explain what I said, but I hope this explanation suffice. Thank you.
Honorable Minister of Environment.
Mr. Chairman, honorable ministers, press, ladies and gentlemen, good afternoon. An update on our disinfection exercise. Let me start by announcing, Mr. Chairman, that from now on, we plan to disinfect this hall on a daily basis just to improve the environmental quality of the hall and also to maintain good indoor air quality. Currently, at the airport here at Nnamdi Azikiwe, there is a flight of essential items that has just flown in, and items will be delivered here in Abuja, and our officers are there, will decontaminate and disinfect this shipment before it's distributed to wherever it is going to be. And then the same airplane is going to Lagos. We have our officers there at standby to also do the same for the cargo for Lagos, and finally disinfect the aircraft itself. An update here in Abuja, we have mapped out 96 facilities and places to disinfect. I'm happy to report to you that we have already done 88 out of that 96, and we have just 8 to go. And then we plan to sit and map out other places that we can now go and disinfect again. My second comment today is on environmental health concerns at isolation centers, treatment centers. Yesterday we were in Lagos, and of course they did a fantastic job putting their isolation treatment centers in place. They have all the necessary, all the bells and whistles. We checked what needs to be done environmentally to contain any opportunistic pathogens that are still lingering. Just because we are focused on corona does not mean there are no other concerns. And that was our concern, and that has been taken care of. So we plan to also do the same with all other isolation centers, treatment centers, to make sure that we have a most effective sanitary system in the area, waste management and everything, especially medical waste, in particular in these areas, will be something that will be highly dangerous. So we want to make sure any isolation treatment centers around the country, the Federal Ministry of Environment will keep track of how the solid waste, everything is being managed there properly. Also, I mentioned air quality, the same thing, with to make sure that air is flowing the way it should. Yesterday, when we saw what we saw in Lagos, they kind of retrofitted their air conditioners so that they are not projecting too much directly on the whole on the people. That's something innovative. We will look at how that can be done in other places that will again improve the quality of the air within. Also, water supply. This is an issue of sanitation. Isolation centers, treatment centers must have adequate water supply. Whether they are hooked to the main or whatever the case may be, there should be reservoirs, a reservoir that will make sure there is continuous flow of good potable water in that area. Also, power supply, because you cannot just depend on the normal grid. We have to have supplementary power supply in these places, because you cannot have isolation centers or treatment centers with epileptic power supply, which will create an environmental hazard. We also want to make sure, again, the Federal of Environment, there's an emergency containment plan in any of the treatment centers around. Lagos has done great in all this, and we believe can be a model for some other states to follow. But the Minister of Environment will be there every step of the way to make sure that these isolation centers, treatment centers are kept in the best environmental quality, again, to stop any opportunistic pathogens that might crop up to cause additional problems. At this point, we don't need anything as we are dealing with this deadly virus. Thank you.
Thank you very much. We have now come to the question and answer phase of this briefing. Again, I must emphasize that, please, we intend to make this national briefing 1 hour at the maximum. Your questions should just go direct, no preambles, no foundations laid. And please don't present more than one question, so that we can give opportunity to everybody who everyone that desires to ask questions. So you have your numbers. We'll take 1 to 10. Number 1.
Good evening, the Secretary to the Government of the Federation, Honorable Ministers, the boss NCDC, and my colleagues. My question is, most Nigerians feel that the COVID-19 is a hoax. That is why the level of compliance on the lockdown is very low. And in as much as I respect the confidentiality of patients, I want to suggest if the
Hey, Emeka.
Hi. Hey, Mom. What are you guys doing here?
We came to call you. It's football time.
No, it's still at home time. Haven't you heard of the lockdown for 2 weeks?
Lockdown? Of course we had, but that doesn't mean we can't play ball.
After all, we're neighbors. It doesn't affect us. It doesn't matter, Ayo. Coronavirus is very deadly. And the best way to stay alive is to stay apart and maintain good strict hygiene.
Wash your hands regularly and sanitize. Keep a safe distance from everyone. Use a tissue to cover.
GF, and just to clear stories in the social media, I'd like to find out, does the task force collect sitting allowance? If you do, how much per day? Did you travel to Lagos by a chartered flight or one of the from the presidential fleet? Now to the NCDC boss. South Africa is conducting door-to-door testing for the virus. Don't you think that this is an option to flatten the curve of this virus with the newly introduced basket fund? Are you thinking of going that route? Thanks.
Good afternoon, everyone. I am Mitaire Ikben of the NTA. I want to know, what is the NCDC doing to trace all the contacts of the doctor who unfortunately died of the coronavirus in Katsina, and what containment measures is the PTF mooting for the state, considering that its first case is a fatality. Again, we hear that the recovery rate of cases in Senegal is very high, with more than 100 cases said to have recovered and discharged. Is the NCDC or the Ministry of Foreign Affairs in touch with the Senegalese authorities to know what treatment is facilitating their recovery rate? And if I would just quickly ask, earlier in the week we learned that a tiger died of the coronavirus somewhere in the US. With this development, is the animal population in Nigeria as endangered as the human population? If so, will it facilitate community transmission of COVID-19? And what interface is the Presidential Task Force having with veterinary doctors in this regard? Thank you very much.
Good afternoon, sirs. My name is Juliana Taiwo Balonye. I write for Sun newspapers. Minister of Aviation, sir, 2 pilots have been remanded in Port Harcourt, and their employers are saying they got your approval, the ministry's approval, and NCAA approval for them to move. We want to get your reaction to this. If indeed you gave the approval, how are you trying to resolve the issues with Rivers State? DG NCDC, sir, can you clear the air on the Benue State Index case? Was the NCDC involved in confirming the test positive? Thank you.
Good afternoon, everyone. My name is Amarachi Wanguma for Voice of Nigeria. And my question comes from the feedback we got from our listeners. Persons with disabilities are saying that the non-establishment of the National Commission of Persons with Disabilities is hindering access to palliative measures to them, knowing that they are the most vulnerable. And they are asking this committee, what plans do you have to ensure that the accessibility of these palliative measures to persons with disabilities? And again, they know that they want to know from the NCDC how many Nigerians with disabilities have tested positive to COVID-19. And I also want to ask this in my local language, Igbo. And ndị nwere arụ nkwarụ n'ala Nigeria, otu jikọtara ndị nwere arụ nkwarụ n'ala Nigeria, na-asị na anyị maara ka ọnọdụ ha dị, na ọ bụ ọnọdụ imere ebere, ọnọdụ ndị na-enweghị ike ịgbata ọsọ oge ihe ọsọ ruru. Ha wee na-ajụ si ka a na-eme ihe a na-ekwu na a na-eke ihe oriri, a na-eke akọrọngwa dị iche iche maka ụmụ amaala Nigeria n'oge ọnọdụ dị otu a, na o nwere ka esi buru ha n'obi, n'ihi na ụwa niile maara na ihe ọsọ bịa na ha agaghị enwewe ike ịgba ọsọ. Nke ọzọ were bụrụ na ha chọrọ ịma na kemgbe ọrịa bidoro n'ala Nigeria, o nwee na ndị nwere nkwarụ wetagoro ọrịa. Ndewo. Thank you very much.
Good afternoon, members of the PTF. My name is Yemi Adebayo from AIT. I just have 2 questions, and the first one is, last week, the Minister of Health did say that the Chinese doctors, alongside the medical equipment we're expecting from China, are to arrive in Nigeria in a matter of a few days. I want to know, are this equipment on ground? Because there are reports on social media now that the doctors have arrived in the country. I want to know if that is true or not. Then the second question is for the NCDC Director General. I want to find out from you, have you given states express approval to announce any positive case of coronavirus in your states? You discover that Kwara and Oyo states governors, perhaps the state governments, will go ahead and announce the cases And some state governments are also following this trend. I want to find out if NCDC has indeed given approval to states to confirm whether they have a case of coronavirus or not. Thank you very much.
Good day, sirs, members of the PTF and my colleagues. My name is Femi Akonde. I'm a reporter with TVC News. Sir, we know that this novel coronavirus, the SGF, sir, the novel coronavirus has a ripple effect on almost all spheres of human existence. And we hear France's economy has gone into recession, sir. We would like to know the state of Nigeria's economy. We also know that the president has, in a proactive move, set up this economic sustainability committee. Maybe once a week, if we can have one of them come to tell us the state of Nigeria's economy, because Nigerians want to know and they are concerned. And sir, quickly, second question to the DG of NCDC and maybe the Minister of Health. It seems your visit to Lagos made you get a clearer picture of the work health workers are doing in helping contain this coronavirus. We would want to know, I don't know if it would maybe breach the confidentiality you talk about I think revealing the identity of patients. Do we have health workers who have been infected or who have tested positive for the coronavirus? Thank you.
The Chairman, Honorable Ministers, DG, my colleagues. My name is Amaka Ude. I report for Arise TV. And my question really is for the National Coordinator as well as the Chairman. Yes, especially for the National Chairman. Since you announced the reduction of the time that people go to the market, that is when we actually observe that more people are on the streets. So is there a plan of reviewing that protocol as it concerns going to the market? Because social distancing is a major issue and this needs to be looked at. And also to the DG of the NCDC, well, I did forward a video to you. It is a video that I find quite disturbing. It's a video of a governor in this country who says, if you wear a face mask, you don't have to adhere to the social distancing protocol. So I want to get your reaction to that video. Thank you.
Good afternoon, Mr. SGF. Good afternoon, Honorable Ministers, DG, and my colleague Rachel from News Agency of Nigeria. My question is to the SGF. So I don't know if the federal government is considering other method of distributing relief materials in order to avoid a breach of the social distancing. And I would like to also know the impact of lockdown to other medical emergencies. My next question is for the DG NCDC. Sir, please, can you describe the process that scientists in the National Reference Laboratory and the other 9 or 8 testing lab have gone through in terms of training that other Nigerian scientists may not have? Thank you very much.
Good afternoon, sir, the Honorable Ministers, and my fellow colleagues. My name is Abiodun Oloyede from Voice of Nigeria. I would like to first ask in English before I will ask in Yoruba. My first question is about the healthcare workers. Surely we appreciate what they are doing. Is the government having any palliatives for these health workers? Then secondly, I want to ask about the Lagos State and Ogun State for the benefit of our listeners at home. There are complaints of being partisan about the sharing of the palliatives. What can we say about this? Then about Kwara State, there are 2 cases of death. We have not heard much about this issue. They were buried in Ofa, and we don't really know what is really happening there. Some people were there. Then also, Oyo State Governor was able to be cured. And he mentioned that he was cured with carrot, black seed, and so on and so forth. What can we say about this? Ní Yorùbá ní kúkúrú, màá fẹ́ kí mínísítà fún ètò abẹ́rẹ́ kan bá mi sáré dáhùn àwọn ìbéèrè yìí. Wọ́n ní kí n dúpẹ́ gidi lọ́wọ́ yín fún àwọn bẹ́ẹ̀ ṣe ń dáhùn ìbéèrè yìí. Pàtàkì àwọn elétò ìlera, kí ni ìjọba ń ṣe láti ṣe àmójútó wọn? Èkejì, ìpínlẹ̀ Èkó àti ìpínlẹ̀ Ògùn, wọ́n rí i pé kùdìẹ̀kudiẹ wà bí wọ́n ṣe ń pín àwọn ohun èlò fún àwọn ènìyàn. Ìkẹta nípa ti ìpínlẹ̀ Kwara, wọ́n ní pé ìṣẹ̀lẹ̀ méjì ti ṣẹlẹ̀ àdẹ̀ tí ìgbọ́n kankan nípa rẹ̀. Wọ́n ti wá sọ pé gómìnà ìpínlẹ̀ Ọ̀yọ́ wọ́n sọ wípé wọ́n rí ìwòsàn gbà nípa àwọn nǹkan tí a kà sílẹ̀ yìí, kí la lè sọ nípa ẹ̀ ṣeun lọ́pọ̀lọpọ̀.
Good afternoon, sir. Good afternoon, members of the PTF committee. My name is Musa Aminu Dambo. I report for Voice of Nigeria Hausa Service. I have one question from the listeners and viewers. They want to find out from the members of the committee that some people are asking for their VVN. Is the committee aware? So I want to ask in Hausa. Yes. Masu kallon mu da sauraron mu suna buƙatar su sani idan wannan kwamiti yana da masaniyar cewa ko kuma shi yasa a ansa nambobi na VVN na mutane da sunan za a tura musu kuɗaɗe. Thank you.
Thank you very much. We have taken all the questions. They have been directed at the Honorable Minister of State for Health, the DG NCDC, the Honorable Minister of Aviation, Honorable Minister of Information and Culture, Honorable Minister of Interior, the National Coordinator, and the Secretary to Government of the Federation. We shall begin with the Honorable Minister of State for Health.
Thank you very much, ladies and gentlemen. I think just about two questions that are really referred to me. The one by Yemi Adebayo, AIT, wanting to know about the consignment in terms of support for our country, Nigeria, from China. To the best of my knowledge, the consignment will arrive this evening. And in fact, that's one of the reasons why the Honorable Minister of Health, Dr. Hanire, is not here. He is presently at the airport awaiting this because it's going to be presented with top officials of the Chinese government. So, to the best of my knowledge, nothing came in before that. This consignment will arrive this evening. And I think just the last journalist, that's Oloyede, I guess, asking about what you could call home remedy or herbal treatment. Well, again, I'm not aware of what the treatment protocol His Excellency the Governor of Oyo State had to test said negative after being treated. I'm not even aware of where he was treated, but we will need that information to be able to make a categorical statement. But having said that, we do know that since this COVID-19 outbreak it came, I got a lot of telephone calls from various people laying claims to having some remedy. But because we have in the Ministry of Health the Department of Traditional, Complementary and Alternative Medicine, what I did was to refer such to that department, to the director, who will invite them, and then in collaboration with the National Institute of Pharmaceutical Research and Development, do a kind of assessment. And of course, there is a protocol for clinical trial. Somebody cannot just come up laying claim to certain remedies without being through the usual or the standard protocol before we say that this remedy will cure or will assist or will help in the management of COVID-19. So I'm saying in effect that up to this point in time, we are not sure, or we cannot categorically say that this herbal medicine will do this or do that. But that is not to say that our people don't have a way. You recall that the bulk of our people who live in the rural areas, their primary port of call still remains our traditional medicine in terms of seeking treatment and other remedies for their ailments. Thank you very much.
So thank you very much, ladies and gentlemen. The first question was whether COVID-19 is a hoax. I think anyone really asking that question at this point so many families have lost very dear ones, people very close to them. There hasn't been an outbreak in my lifetime that has played out in real time as much as this one has. We've been in touch with many of these patients, and myself, the Honorable Minister has called many of them himself. This is not a hoax. If patients want to talk about their experience, it's really up to them. It's not us as government to push any patient to speak about their experience of an illness. I noticed on social media today that one or two of those that have been discharged have been speaking about their experience. If you want to hear from them, I encourage you to reach out and let them decide whether they want to share their stories with the press. But it will be inappropriate for me or for any member of this government to ask patients to share their experience with the press or with anyone else. It's completely their decision to do so. On the question on testing, there will be many lessons learned from this outbreak. One of the most important ones in the long term is to build up our laboratory architecture. But the honest truth is we cannot do it overnight. We're working as hard as we can. The strategy, South Africa, and I worked there for 3 years, has a national laboratory service. It's fairly well developed. They have a private lab, medical lab architecture that is fairly well developed. 70% of the tests in South Africa, as I understand, have been done in the private sector. So they've been able to mobilize their existing private sector laboratory services to come and support the public sector. Unfortunately, we don't have that level of sophistication right now existing that we can simply mobilize to do this. This is the reality that we have to change collectively. So as I speak, I also challenge all of us, state governments across the country, let us work together to build this architecture that we need well into the future. A lot of the things you see drive-through testing, it doesn't mean that the test is happening there. The samples are collected and then taken to the labs. So it's an absolute priority for us right now, and we're working across board to increase the throughput of our testing, and with some of the efforts being put in by government, both to convert some of the TB machines, gene expert machines used for TB diagnosis, and some of the high throughput machines for HIV diagnosis. But those will not happen overnight. Earliest dates for that 3rd week of April, 4th week of April, we'll be able to get to the stage where we're doing that. But we're working very hard now to increase our testing capacity across the country. There was a colleague with 4 questions. One was around the gentleman that just passed away from Katsina. You know I will not discuss the individual circumstances around that. And actually, this death just happened yesterday. So even if I had the information, we are still in the process of working that through, validating some of the processes, identifying all the contacts, validating them, following up. All that is work happening today. In fact, as we speak, our team is just on the way to Katsina, even though we've started communicating with them. So I can't answer specifics on that. On the circumstances in Senegal, the West Africa Health Organization, actually one of the most important developments since the last Ebola outbreak in Africa is the growth of, one, the Africa Center for Disease Control, and secondly, the strengthening of the West Africa Health Organization. Because what it has done is bring us together in Africa. So we have teleconferences frequently to share experiences. So we have one recently we have one weekly across West Africa, organized by the West Africa Health Organization. Through that, we share experiences. It's too early to analyze what is happening in each country in terms of why it is happening, because you need numbers, and unfortunately, we don't want those numbers. But that is how you really get to the answers. So we share experience, so we are in touch with colleagues in Senegal. We are studying what their situation are, and we also share our own. And in fact, one of the areas that lots of African countries have learned from us is the website that we have where all our documents have been stored. No other country has developed something like that, and they've been very grateful that we've shared our guidelines with everyone to download themselves, adapt to their own context, and use. On the report on COVID-19 in an animal, I saw that too. It's too early to know whether that's a coincidental finding or whether that has any real relevance for transmission. Because the importance of such a finding is, does it have an impact on human health, i.e. is that animal a host or helps transmission of the virus among populations, or are animals dying off from it? So none of those have been shown. So at the moment, it's just that one report that we have to go on. There's a question on the case in Benue. The only thing I can confirm is yes, the test was done in one of our labs. There's nowhere else you can do the test at the moment, and we stand by the results of that test within the limits of any microbiology test. None of them is 100%. The Honourable Minister has commented on remedies. We should remember that 90% of these patients recover without any intervention. So if you take something and say you recovered, and that something is why you recovered, it doesn't quite add up. So hopefully there will be some treatments emerging over the next few years. But remember that people recover from many viruses. That's the way it happens. There are very few viruses with a cure. Even the ones that have a bad outcome, like Lassa fever, 20% of patients that die from it, it still means that 80% of patients will recover without any treatment per se. What happens is the body is supported to recover on its own. So you go to a hospital, you're given, for COVID, you're given oxygen. Oxygen is not really a treatment. It's to keep you alive for long enough for you to recover yourself. I haven't watched, Amaka, I haven't watched the video you mentioned about face masks. And as you know, we are considering a policy statement on face masks. That policy statement is currently being considered by the PTF before release. However, what I can already say for sure, the face mask alone will not stop transmission. Even if we were to recommend the use of face masks, broader use of face masks, we will recommend it in addition to physical distancing, to personal hygiene, to respiratory hygiene. It will add one additional tool to the already existing and recommended efforts to keep ourselves separate from each other. So there is no magic bullet here, and I can say that with confidence even without watching the video. But I will watch that video and respond to it specifically, because we all have a responsibility to give out correct messages, and no one has that responsibility more than our governors. And that also brings me to the question about the reporting of results of individuals. And we are really appealing to our leaders across the country. Please let the experts do the reporting. Nobody should reveal the identity of a patient, even if it's the first patient in your state. Please do not reveal the identity of a patient, the circumstances, whether he's a doctor or not. We don't need all of that. This is a virus. They haven't committed an offense. They haven't done anything wrong. We have to be empathic. We have to show empathy towards all our patients. That is what we sign up to as healthcare workers. So I really appeal to our political leaders to follow the lead of this PTF, you'll never see the chair talking about the history of any individual patient. So a lot of credit to him, and take that example in the States and let us say what we should say. And many of the commissioners know how to communicate these things. But once it's taken over by our political leadership, sometimes, and none of this is ill-intentioned, it's just not understanding the ethics and norms of the medical practice and of public health. Finally, on the question around, so there are two more questions on training of lab scientists. I know there's been a lot of chatter around this. Lab scientists are the biggest single profession of people working in the NCDC. There's no other profession that has more, there are more people working in NCDC than medical lab scientists. The truth, however, is not just the techniques of what medical lab scientists do. It's the ability to work in a biosafety environment. When you're working with infectious diseases, there's an added level of training that is required. The truth is that level of training is not available in any of our teaching hospitals. So nobody comes to NCDC ready to work. They come ready to be trained. We then spend sometimes several months preparing them to work safely. To work safely means not just doing it, but making sure you are not infected by the viruses that you're working on. So when I say that everybody requires some extra level of training, you have to have had the opportunity of working in a biosafety environment for you to work on this new virus. And that is what we do. So we cannot bring in 100 volunteers and throw them into the lab. We have to enable them. And so we have recruited 10 ad hoc staff in the last week. We will recruit more to support the response, but we cannot recruit hundreds of people at the same time. We recruit a few, we train them, they join the workforce, we start training a bit more, and that's the process that we've been undertaking. In terms of persons living with disability, as far as I know, I don't think there's been anyone yet. To be honest, the clinical details of each individual patient is not my responsibility. I manage the public health response. The clinicians manage each individual patient, but I am also not sure that they will be open to discussing the physical well-being or mental well-being of any of our patients. But these are important questions that we'll get to at the end. And just a final point in Igbo, ndị nwere ọrụ enwebe nke ọbụla ịma, enwebe onye ọbụla ịma n'ime ndị nwere ọrịa kịta kama anyị ga na-eleba anya n'ime ajụjụ a ma anyị na-aga n'ihu. So thank you very much. I just answered the question on disabilities, people living with disability in Igbo. Thank you very much.
Distinguished ladies and gentlemen, first and foremost, regarding the question that has been asked, the arrest of pilots in Port Harcourt, whether we give them approval to fly. Civil aviation is on exclusive list, item number 3 there. So no other person but the federal government has authority to legislate upon. So also the Nigeria Air Force, part of Armed Forces, is also on exclusive list. There's no other person but the federal government that has the legal right to legislate upon. So the Air Force officer who jumped the commander-in-chief and ignored, who also jumped the chief of defense staff and ignored, who jumped the chief of air staff and ignored, to call a governor to come into the property of the federal government belonging to Nigeria Air Force to make an arrest, has exhibited dangerous ignorance and incompetence grossly. So the police that followed the governor also to go in there has also exhibited dangerous ignorance from our perspective in civil aviation. Whether we gave approval for the flight, yes, we did. And we did in national interest. All of those flights are for the purposes of improving the national revenue, to which Rivers State is the greatest beneficiary. So those flights, by Caverton, by Aero Contractors, by ARIC, by Bristol and couple more were for national interest and improved national revenue. At a time when oil has gone below $30 and the cost of production is $30, in the wisdom of President Muhammadu Buhari, he thought that this be allowed, even in this national pandemic, so that the nation will not be crippled and national revenue will not be lost. It's against this background that we had the authority, and being it exclusively on the exclusive list, and we had the powers in civil aviation, guided by Civil Aviation Act 2006, approved such flights. So those flights were approved lawfully, legally, and correct. So, yes, we will do everything lawful and legal and reasonable to get those pilots back, and the operations will continue in national interest. Thank you.
Honorable Minister of Information and Culture.
I believe most of the questions that were directed to me have been answered by the various ministers. But the one that I think I want to take on is the issue of the sitting allowance of #500,000 naira paid to each member of the committee. You remember, every time I come here, since I tested negative for coronavirus, my other major problem is fake news. As soon as I got that information, I consulted with my colleagues here whether I am not a member of the task force. And I asked them whether they've received their own. And they said no. But you see, what bothers me is that since about 2 o'clock this afternoon, I've been receiving text messages to send money to people, that they were broke, they had no money. And I've begun to wonder, why today? Apparently they are acting on these fake news that will receive #500,000 naira every day. The truth of the matter is that no member of the committee has received 1 penny, either for sitting or sleeping allowance. Not even when we went to Lagos yesterday. So you see, and this fake news is aimed at one thing and one thing alone, to distract the government from the more serious problem and task of containing and combating fake news. I want to say loud and clear, no member of the committee receives a penny as sitting allowance. Everybody sacrifices his time, his energy, and even sometimes his resources. Thank you very much.
Honorable Minister of Interior.
Well, I must greet all Nigerians. The one I'm going to talk about is food distribution in Lagos. The first phase has been concluded. From the information gathered in Lagos yesterday, the government is about to set on the second phase. I want to believe they are going about it very, very well. From my own interrogation or interaction with people, I discovered that there is a gross misunderstanding. Is it misjudgment on the part of a section of the population on how far can this thing go? And I felt I should do some analysis to throw light on this area. Let's take 1 billion naira. How many Nigerians could 1 billion naira serve? Because it's important we elucidate on this to inform people about their expectations. 1 billion naira will go round the following people in this order. If we are to give 1,000 naira to deserving Nigerians, a billion naira will serve only 1 million naira, 1 million people. If you are to give 1,000 naira to people, a billion naira could only serve 1 million people. However, if you are to make it 1,500, a billion naira will serve 667,666 people. If it is 2.5, if I are giving 2,500 naira, only 400,000 Nigerians will get 2,500 naira. So, if this is the case, we can only therefore approximate how many Nigerians or Lagosians can really benefit from what is going around. That does not mean effort will not be made to get to as many vulnerable, indigent people as possible. The government has assured us that it will do everything in its power to reach far and wide. But the analysis I've made is just to let us realize that there is a limit to what can be done. And I'm impressed, or we are all impressed, at the task force level, at the presidency level, and at the federal government level, and at all governments level, about the enthusiasm of the Nigerian people and their commitment to relieve the burden on the vulnerable and indigent citizens. I've seen Nigerians in their various ways rising up to support those who could not feed themselves. We must encourage this as we are thanking all those who are doing such things. We are in a difficult moment, a moment that calls for sacrifice, patriotism, and commitment from all. As a matter of fact, I was discussing with somebody, and I told that person that we do not really appreciate very deeply what is happening. An invasion of a nation can only happen progressively from the point of invasion, and if there's no check, and there must be check anyway by any serious nation, progressively, that is one step after the other. This is an invasion that, though not visible, is occurring simultaneously on every street, in every home. We must therefore appreciate what it is we are up against. And if I want to quote the SDF, chairman of the Peritoneal Task Force, he says something that COVID-19 is not only attacking our health, it's attacking our wealth. And he says something which he has been repeating, that COVID-19 is the most important public health emergency in our generation. If you all approach it from this point, or from this perspective, to be clear to us that everybody must rise up to it and do whatever we can to support the government and support ourselves and our people. Yorùbá nǹkan tí mo sọ òun ni wípé ohun tó ń wà nílẹ̀ yìí kò ń ṣẹrù ẹnìkan o, gbogbo wa ni a ní ìdààmú yìí. Tá a bá dẹ̀ fẹ́ kó kásẹ̀ ńlẹ̀, àyàfi kí gbogbo wa ká gbárùkù tì o. COVID-19 ò ní gbé wa lọ, àwa la máa borí ẹ̀. Ẹ ṣé o.
Coordinator.
Thank you. I think I have only one or two questions, but before I go on, I just wanted to reiterate what the DG and CDC say. Those that deny the existence of coronavirus disease or the current pandemic are being disingenuous, but it's even more harmful to society when you start claiming that certain treatments work or if you start, when people start advising the public not to take the precautions that have been recommended by the scientific community to protect themselves. In China, when the pandemic happened, they had about 80-something thousand people infected, 92% fully recovered. So, and they could have been taken kola nut every day and claim that kola nut was what was responsible for them getting better. But the fact is the majority will get better. So it doesn't matter what you take, you will get better. With regards to Senegal, I had a look at the data. So Senegal have 244 cases now, and they had 2 deaths. Nigeria had 254 and had 6 deaths. It's really too early to say whether those figures are any different. We're still very early on in the epidemic, just like Senegal is. And then there was a question about more people are on the streets since we announced changes to the timing. Yes, we are reviewing this regularly. You probably noticed that here in the FCT, I think the police have become even more strict in the last few days when it comes to restricting movement. But as I've always said, this is a joint effort. We cannot do this alone. Even though we are advising people, and to certain extent we will enforce some of the changes for the public good. We still expect people to cooperate with us and be sensible and keep themselves safe and their loved ones. Is government having any palliatives for our healthcare workers? Well, all I can say is our biggest asset, as far as the PTF is concerned, it's not the commodities we have coming into the country. No, it's our healthcare workers. And we have to do everything we can to make sure that we protect them and to make sure that they are incentivized to work in order to save the lives of our citizens. And we will continue to commit to this. Health is on the concurrent list, but we're already speaking to state governments, as I said, regarding health insurance, etc., and life insurance, and we'll continue to work with other partners to make sure that our health sector staff are well compensated for. Thank you.
We will now take the chairman of the Presidential Task Force, the SGF.
This thing is doing me one kind. Yeah, whether it's being affected by coronavirus. Truly, I just want to read a post that Dr. Sani sent to the PTF COVID-19 WhatsApp in my attempt to answer the question that a lot of people think coronavirus is a hoax. It's been disclosed. There's a post on somebody's Facebook page, but I will read it so that I can drive home a certain point. That at this point, a lot of people like the DG Center for Disease Control rightly alluded to have lost loved ones. And he has spoken to a lot of families whose loved ones are either infected and undergoing treatment, or they have lost loved ones. So my appeal is that at this moment, let our spirit of humanity guide our utterances and our conduct. Probably when you hear this, when you listen to this post, it will help you in even pushing the message out there. This is somebody that posted today. He said, today at approximately 7:30 a.m., my dad died of coronavirus. He has been fighting the virus for 2 weeks, but he could not fight it anymore. The NHS, which is the British medical system, were amazing and did everything they could. My dad was a living legend, worked for the NHS for nearly 40 years, saving people's lives here and in Africa. And I confirmed from Dr. Sani that this man was a lecturer in the Faculty of Medicine in Ahmadu Bello University, Zaria. Up until he got sick, he was still working part-time, saving people. The coronavirus is not a joke. Please take it seriously and listen to the government. Please stay safe and protect your loved ones. Nothing is more important. Listening to this, I think we've gone past the stage. However ignorant a person is, wherever you live in Nigeria, for you to begin to assume that this is a scam, a hoax, or a joke. And I think those of you in the media have a responsibility of driving this point. That this is not a joking matter. We've gotten to the stage where we are beginning to see some of the things that are happening in other climes. So we ought to take it with every element of seriousness. And for those that think it's a hoax or a scam, I wish them well. But for those of us that believe that we have to do everything humanly possible to contain this spread and limit infection and mortality, we will continue to work day and night. And that is why I solicit your support and your cooperation in this particular endeavor. The second question has to deal with sitting allowances and how we travel to Lagos. Sitting allowances in the governments of different, either the states or the federation, are guided by certain extant rules and regulations. Some of you, before you ventured into media, if it's a private media you work for, if you still work for government media, you know that there are extant rules that guide the payment of sitting allowances if you serve in committees or commissions or task force. But let me say upfront, I saw the post where somebody was alleging that the federal government has withdrawn $150 million, and out of which they are paying the committee members of the task force 500,000 daily as sitting allowance. Let me say, as the chairman of this committee, since we started functioning as the committee, we've not received a dime, either by way of even operational costs, talk less of sitting allowances. And like I said, sitting allowances are matters of regulation. They are there in the public service rules and regulations. It will be applied when the need arises, when funds are available. But to allege that members of this committee have started receiving 500,000 a day, how many days have we sat now? No wonder you are getting text messages, because the people in your constituencies are assuming that you are fully loaded. I beg, save us that agony. We don't have to go through that. by people barraging us and bombarding us with requests based on a speculative pause that this is what we receive. These gentlemen and ladies that are on the committee are honorable people. They know the difficult times in which we operate. This cabinet has sacrificed half of its salary already as their own modest support towards the fight against COVID-19. So I don't think they would indulge in such a thing. Yes, the economies of the world would suffer. There is no doubt about it. And recovery will not be tomorrow or next tomorrow. For all of us that understand the dynamics of world economies, you know that we are in for a long haul. And it's true, I saw in the news that the French economy has got into recession. We have not gone into recession yet. And our president is a very proactive man. As he was setting up this task force, he knew that our economy would be affected adversely. He set up another committee headed by the Minister of Finance and Budget and National Planning. That is the Committee on Economy, to look at the impact of COVID-19. In addition to that, they have made several recommendations. He still went ahead to ask his vice president to chair another committee, which is the Economic Sustainability Committee, all in an attempt to have a holistic picture of the adverse effect of COVID-19 on the Nigerian economy. And how do we keep the wheels of our economy running? How do we create sustainability? Because there is life after COVID-19, and we must plan for it and plan adequately. So all in all, if you look at in context, everything that has been put in place is to ensure that we do not suffer adversely in our health and in our wealth, so that at the end of the day, Nigeria will come out much stronger and much determined and resolute in dealing with the affairs of our nation. The other question has to deal with, how did we travel? Channels. The fact of the matter, in a state of emergency like this, I can even impound your aircraft if you have one, if I have need to go to Lagos. We have a Nigeria Air Force. Their business is flying. They have planes. We've asked them to go to Lagos to move drugs to Abuja. Even this afternoon, I had requested the Chief of Air Staff to dispatch an aircraft to Lagos because we have received certain consignments that were supposed to have been dropped here from Turkey that were dropped off in Lagos to be brought to the storage facility that we have here, the central stores of the Federal Ministry of Health, so that it can be equitably accounted for, transparently, and distributed for the good and use of our people. So we have aircrafts in our Nigerian Air Force. They have, and the Chief of Air Staff has been rehabilitating several. We'll put them to use during this time of emergency. And I can assure you that if we have to go to Sokoto tomorrow, if we don't have a plane from the Nigerian Air Force, if you have one, we will impound it and use it to go to Sokoto. Other ways of distributing palliatives so that we do not breach the social distancing policy that we have been advancing. It's very true. The first experience of the Ministry of Humanitarian Affairs, Disaster Management and Social Development, she was here. She acknowledged the fact that it became very difficult to control the people. I believe that she must be in placing a plan that will help her in trying to make sure that in the process of giving palliatives, you do not endanger the health of the people that are supposed to be beneficiaries. Even this afternoon, we spoke about it. We took a report from that ministry, and they have assured us they are putting so many processes in place. Our banking system does not get to every nook and cranny of our country. And the processes of payment through the banks have been looked at. So it's a combination of payment through the bank and also table payment with regards to disbursement of cash. But we try to do the best we can to ensure that it's transparent and the elements of accountability come into play. Asking for your BVN, this is share 419. Even in the midst of this pandemic, some people will want to play and exploit the ignorance of a lot of people so that they can defraud them. Please advise the Nigerian populace not to disclose or release any information of a personal status like a BVN, or asking for your credentials, asking for all sorts of information. All is intended to have access to your small savings, in spite of the fact that everybody is faced with the current challenges. So this is sheer work of fraudsters, and as much as possible, we should discourage it. Thank you very much. Well, we have not shut down the hospitals. The hospitals are there. The pharmaceutical shops are there. All facilities that have to deal with the hospitals are some of the institutions that have been exempted from the lockdown. So you can access the hospital if you have any need to go. Though as much as possible all over the world, people are being advised, except if it is a very dire situation, stay off from the hospitals for now. All over the world, that's the advice. That's the advice. This is not the time to walk into the hospital because you don't know the kind of patients that are coming. And you wouldn't want to take something home that you didn't bring to the hospital. So the counsel is that even that, if it is not a serious matter, in other jurisdictions and climes, even where there have been scheduled appointments for surgeries, they've been put off. Because all the countries are dealing with situations that they cannot combine with routine visits to your doctor and to the hospitals. So as much as possible, our advice is that except if it is a serious ailment that you cannot endure or you have not received prescriptions for, then you go to the hospital. But as much as possible, at this moment, it is even advisable that you stay away from unnecessary visits to the hospital. I hope I've answered that.
Thank you very much. That brings us to the end of today's national briefing. Before we go, we must thank our partner media houses and our colleagues for keeping faith and attending this national briefing every day. We must also thank NAPTIP for providing the sign language. The messages coming out of today's briefing are this. One, COVID-19 is real. It is the most important public health emergency of our generation. Please stay home, keep social distance, and maintain personal hygiene. Stay safe, protect your loved ones. By the grace of God, we shall see you here tomorrow at 2 p.m. God bless you all. Thank you.
How are you?
We came to call you. It's football time.
No, we stay at home. Of the lockdown for 2 weeks.
Lovely evening to you and welcome to Nationwide on the network service of the NTA. I'm Najat Tijani with the news. As at 9:30 p.m. on the 7th of April 2020, there are now new confirmed cases of COVID-19 in Nigeria, bringing the total number of confirmed cases to 254. Of the 16 new cases, 10 are in Lagos, 2 in the FCT, 2 in Oyo, 1 in Delta State, and 1 in Katsina State. These new cases increase the number of cases in Lagos to 130 and that of Abuja to 50. The NCDC says 44 patients have been discharged and 6 deaths have been recorded so far in the country. Now, the Presidential Task Force on COVID-19 has just finished briefing the media on the situation of things regarding the national response to the coronavirus pandemic. Let's now join our correspondent Mitaire Ikpen at the office of the SGF for highlights of the briefing. Hello, Mitaire. Can you hear me, Mitaire?
Thank you. The Task Force on COVID-19 reported today this briefing that the country is now beginning to experience few.
Hello, Mitaire. Are you still there?
Travelers. Also.
All right, then we'll join Mitaire. We seem to be having signal issues there. We'll join him once we reestablish the connection. 3 persons who had direct contact with the late Dr. Aliu Yakubu, who died of COVID-19, have presented themselves to health authorities in Daura for further examination. Similarly, health authorities in Katsina State are calling on other people who had contact with the late doctor to present themselves. Correspondent Ado Ali Ibrahim, however, reports that the premises of the clinic where the late doctor operated from has been sealed. Meanwhile, life goes on as usual in Daura and environs with little or no adherence to social distancing and other precautionary measures. Now we'll try to re-establish the connection with Mitaire Ikpen.
Have a history of travel and may not even necessarily have a history of contact with a positive person, and that really means that community transmission is starting to happen. The messages as well that we need to put out, especially to our state governors, is the need for us to have a cohesive sort of communication line, so that the public will not continue to be confused with regards to COVID. There are certain things that are facts when it comes to coronavirus infection, particularly as it relates to protecting oneself from getting the infection. So things like hand washing, for instance, things like respiratory hygiene. If you're coughing, keep away from people and cough into a tissue, for example, making sure that you disinfect surfaces. So all these measures work, but what works even more is keeping away from people that might be infected.
Thank you very much, Doctor. So that's it from here. Najatu is back to the studio.
Thank you, Mitaire Ikpen. And we'll be giving you more updates from time to time. In the meantime, 500 beds and other medical equipment have arrived the Sani Abacha Stadium Isolation Center as part of preparations against COVID-19 in Kano State. Fatima Sanusi Arai reports that preparations are in top gear for the center to be well equipped and ready for use if need be.
509 makeshift isolation center was established out of desire by the state government in collaboration with Ngote Foundation to fight the spread of the deadly pandemic which is ravaging nations. This isolation center is meant to treat only mild cases of coronavirus.
If there's any confirmed case, that's the one that will be moved forward to this particular isolation center. So it's not going to be open for everybody.
The center will house both female and male sections with 254 beds each in 2 different tents with mobile lavatories.
If there's any critical case, it can be transferred to the Kwana Dawaiki Isolation Center, where we have ICU beds, ventilators, and other oxygen and other facilities.
Kano State has not recorded any confirmed case of novel coronavirus, as all suspected cases tested negative. In Kano, Fatima Sanusi Arai, NTA News.
Thank you, Fatima. Now, the aircraft which conveyed Chinese medical items and personnel from China to Nigeria has just arrived at the Nnamdi Azikiwe International Airport, Abuja, where representatives of the federal government and the Chinese government are ready to receive them. Emmanuel Ayimiru is at the international wing where the items and medical personnel are being received. Hello, Emmanuel.
Hello, studio. I'm live at the international wing of the Nnamdi Azikiwe International Airport, Abuja, where Nigeria is receiving the second foreign consignment of medical items coming from China. You remember that last 2 weeks, a couple of items came from Jack Ma Foundation, and this time around, a construction company based in Nigeria called CCECC has donated some of these items. The Nigerian local airline, that is the Air Peace, left China yesterday and arrived at the international wing this afternoon to deliver this item. A couple of minutes ago, the Minister of Health, Dr. Osai Ehanire, and the ambassador of China to Nigeria, Dr. Jinping, were on ground to receive these items, and they make remarkable comment about what those items should be used for. The Chinese ambassador said the total value of the item is about $1.5 million, and that these items are going to be used to contain the spread of the virus. Also, about 16 or 17 medical personnel also arrived the country. The Minister of Health said that those 16 medical personnel are going to be guaranteed for about 14 days, which is the required standard of days, until when they are allowed to begin to render some assistance. And when we try to find out what kind of assistance, he said the assistance will be in terms of capacity building.
Thank you very much, Emmanuel Ayimiru. Now, what about have you actually seen the goods? What are some of the things, what are some of the equipment that we have received? Can you hear me, Emmanuel? What
include?
Did you get that? What? Some of the equipment we have received.
The numbers have not been actually made known to us.
Bills that you've seen. Have you actually seen any of the items? What are some of the materials? Have you seen any of them?
Behind me. The medical protective materials were not really brought out from the package. You can see them behind me. They are in their hundreds. Some have actually been taken into a waiting vehicle.
Thank you very much, Emmanuel. Thank you very much for that update. We'll rejoin you again later. Thank you very much. Now, fears have gripped residents of Folawio Street in Okerin area of Ilorin over the return of a woman who is believed to have attended the burial of the late suspected coronavirus index case in Ofa, Kwara State. Ahmad Fulani reports that the residents are willing to subject themselves to COVID-19 tests.
This is Ifesowapo Street in Okwere, Ilorin, and I am in front of the residence of the woman who is believed to have had contact with the wife of the late deceased who died of a suspected coronavirus. But the problem right now is that people living in this area are panicking because they don't feel safe.
No, we did not know that the issue is real. People are saying, it is food poison. It is food poison. Some said it is coronavirus. So we did not believe, not until the result of the wife is out. That's when I believe.
The situation now is everybody is panicking because we all are aware of the COVID-19. And even we in the residence, we are afraid.
And now let's join Hingino John Adams in Lagos for contributions from that zone. Hello, Hingino.
Hello, Naja'atu. Since the lockdown, Lagosians have continued to comply with the government and supermarkets are not left out. Annie Daniels reports that though it is no longer business as usual for supermarket operators due to low sales, they have however remained resolute in their fight against coronavirus.
Idowu Taylor Street on Victoria Island houses several supermarkets. With the lockdown in Lagos, several of such supermarkets have closed for business, even when the signposts say supermarket is open. However, for a few that are still open to the public, COVID-19 is their greatest fear, so they are leaving nothing to chance to stop the spread of the virus.
Before you enter the supermarket, they go put the relaxers in your hand. You have to wash your hand and clean your hand before you go inside the bed. We are liking the way that they do it.
I'm impressed with the level of safety, and in the supermarkets they're checking our temperatures, giving us hand sanitizers.
Sometimes they say it's not safe to come to the shops for groceries because of the coronavirus. But if all these measures are in place, it will help one, and they will maintain distance.
Some other customers who declined speaking on camera and the management of these supermarkets say, as it is now, adhering to social distancing and the use of hand sanitizers will remain a very vital part of their daily routine until the unseen and deadly enemy, coronavirus, becomes a history. In Lagos, Annie Daniels, NTA News.
With the coronavirus pandemic adversely affecting businesses and livelihood, the federal government has given directive on provision of food items to the vulnerable. This, the Western Marine Command of the Nigeria Customs Service is keen into by providing bags of rice and other food items available from its storage facilities. The controller of the command, Oluboyega Peter, said this at a press briefing to showcase seizure of 340 bags of foreign rice and 4,500 liters of fuel. Michael Olale reports.
Regardless of the prevailing global pandemic, the Nigerian Customs Service is not compromising its constitutional responsibility as measures are being intensified to strengthen its anti-smuggling architecture and antics, especially as criminals might want to take advantage of the lockdown in Lagos to perpetrate their illegal acts. This vigilance is yielding results, which has led to the seizure of 342 bags of rice with duty paid value of 7.5 million naira. The most disturbing scenario was the use of 30 large sacks to smuggle petrol, with each containing 150 liters across border. Other items seized include 5 bales of fabric material and 2 bales of second-hand clothing.
The house we are making use of, is filled up. That's why some of the items, some of the foreign rice now are now stacked outside. So within the next 24 hours, I'm sure we have been asked to send them to IDPs and the rest. That continue to arrest them and seize their goods. But the best bet for them is to change their lifestyle, to change their means of livelihood from illegal business to legal business.
The entire seizure, put at about 20 million naira, were intersected at Yekeme and Badagry axis of the Western Waterways. In Lagos, Michael Olale, NTA News.
That's it from Lagos. A break beckons now. The news continues after that.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
Illegal oil refineries are devastating. Crude oil theft is criminal. Oil spill due to vandalism is dehumanizing. Piracy is inimical to the economy and international trade. From the creeks of the Niger Delta to the Atlantic Ocean, inland waterways and beyond, the activities of criminally minded Nigerians and their foreign collaborators have hampered Nigerian economic growth, constituted health hazards, and environmental degradation. The Nigerian Navy is poised to put a stop to these activities. Remember, the harmonized standard operating procedure in the maritime sector for optimal benefits of the nation's economy is fully operational. The Nigerian Navy will leave no stone unturned to ensure defaulters face the full wrath of the law. Ignorance of the law is no excuse. Be one. Support the Nigerian Navy. Onward together.
The main way coronavirus spread is when infected people sneeze and cough. Small droplets of fluid expelled by cough or sneezes are laced with viruses looking for new respiratory tracts to infect. When a sick person sneezes around someone who is healthy, the virus can land in the nose, mouth, or even the eyes, causing an infection. Symptoms can include fever, cough, shortness of breath. Symptoms may appear within 2 to 14 days. Seek medical advice if you develop symptoms and have been in close contact with a person known to have COVID-19, or if you live or have recently been in an area with ongoing spread of COVID-19. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
James, I don't know, you need to answer your call. This. Hello?
Is this Mr. Peter? I'm calling from the NCDC. Your friend, Mr. James Okripocha, was brought in this morning and tested positive for the coronavirus. He mentioned that he had been in close contact with you.
God forbid bad thing.
Sir, I am not saying that you have the virus, but you have spent some time with him over the past 14 days, and it is better if you self-isolate immediately.
I don't know any James at all. Even only James in the Bible that I know as a good Christian.
Sir, he showed us pictures.
Now, wow. If you have come in contact with someone who has tested positive for the coronavirus, self-isolating is key to protecting those around you. Remember, viruses don't move, people do. Stopping the spread is in your hands.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Welcome back to our network studios. And still on the COVID-19 index case in Offa, we have joining us via Skype the Olofa of Offa on the mood after the death of the COVID-19 index case. Thank you for joining us, Your Royal Highness.
You're welcome.
Your Royal Highness, can you tell us the current mood in Offa regarding the COVID-19 case?
Everybody is just trying to make the last minute rush to buy some things in the market. As the governor has announced that from 6 p.m. today, there will be total lockdown for about 14 days.
Now, Your Royal Highness, how about the sensitization? What efforts are you making to complement what government is doing to sensitize the people?
For more than 3 weeks now, we've been sensitizing our people, telling them the need for the social distancing, washing of hands, and thank God the state government gave us a lot of hand sanitizers and soaps and face masks, and which we have distributed to the whole people in the town. In a nutshell, the whole town is all aware of what needs to be done, and they are doing it now.
So now the stay-at-home order, how are residents reacting to the news of both the lockdown and the stay-at-home order?
We have made them to understand that the stay-at-home is for our own safety, and they have come to agree with us. So they are ready to abide by what the government said.
Thank you very much. Thank you very much for the update.
Very much. You're welcome.
And now close to 50 health workers have been trained on how to prevent and curtail the spread of COVID-19. The training was organized by the Benue State Action Committee on COVID-19 at the Government House, Makurdi. Charles Abba reports.
Well, I will say this is highly necessary, and based on the current happenings, it is very important to conscientize health workers every now and then.
So in the course of administering care to these patients, you can also infect yourself, especially with reference to COVID-19.
Participants at the training are medical doctors, nurses, laboratory technicians, and others.
You know that this is a special group in the sense that those that work in the hospitals come in contact with their family members, with the public, with patients, and those that come to the hospital. So if any one of them gets down with it, you can see that it's the fastest way to go.
Paper presenters at the program, who cautioned the trainees to be wary of being predisposed to the virus, instructed them on step-by-step safety techniques from testing to the point of isolation of patients. The training is to be replicated in the 23 local government areas. In Makurdi, Charles Abba, NTA News.
And now from the training in Benue State, we'll take a look at how laboratory scientists are coping with COVID-19 in Nigeria. And joining us in the studio is the Dr. Kasmir Ifanyi, who is the National Publicity Secretary, Association of Medical Laboratory Scientists of Nigeria. You're welcome to our studios, sir.
Thank you. It's a pleasure to be here.
Now, COVID-19, this pandemic has affected everyone in the world, and everyone know that laboratory scientists are deeply involved in this fight. Can you tell us how so?
Yes, it's true. If you had listened to this afternoon's briefing by the Presidential Task Force COVID, you would have heard when the DG and CDC said it expressly that most of the healthcare professionals with him at NCDC are medical laboratory scientists. And that's how to show how vital the medical laboratory science profession is in health and disease time. And of course, at a time like this, we had said severally that what we need to do We have been testing for close to 6 to 8 weeks now, and we have just tested, of course, not more than 7,000 persons. And we're quite lucky that the case rate is still very slow. We have 254 as of today. Now, what we need to do to really define the disease burden in Nigeria is to upscale testing. And that's why we must appeal to government, particularly the Director General of the NCDC, to take a closer look at the list of qualified medical laboratory scientists with skills and competencies in molecular diagnostics that the Association of Medical Laboratory Scientists of Nigeria had transmitted to him. He should profile them and determine those that he could work with. Today he did say that med lab scientists do not leave the teaching hospital prepared to work in biosafety environments and other stringent requirements of molecular diagnostics. That used to be in the days when I and himself were together in University of Nigeria. He has long changed. With cases, with the interventions and programs we had with HIV, there are several PFA-supported laboratories in our federal medical centers, in our teaching hospitals, that we can ride on as a platform for upscaling training. And I want to assure him that we are richly endowed with medical laboratory scientists with competencies and skill in molecular diagnostics. We are the ones training them. We are not telling him what does not exist. If you move around the tuberculosis control programs, where we have well over 700 gene expert machines deployed in Nigeria, is a molecular technique. And medical lab scientists are actually the ones behind them.
Let me cut you there, Doctor, and focus on upscaling testing, which you mentioned.
Yes.
The process of tracing those who have had contact, how has that been for the medical laboratories, the lab scientists?
You see, when you talk about public health disease surveillance, that is where tracing comes in. It cannot be done without the medical laboratory. It's like navigating without a compass. The compass for health and disease across the globe and everywhere is medical laboratory science. In this pandemic that we have today, if you go close to, of course, the epicenter, the infectious disease hospital in Yaba, mainland Yaba, Lagos, you find out that medical laboratory scientists are the front runners in one, contact tracing that you have talked about, because you will, like the advert you just played on your during your interlude, you find out that that person was contacted, and so eventually a team, including a medical lab scientist, may go to his home, and it is until we sample him that you can determine his status. And so we actually encounter COVID-19 naked, because as at the time somebody has not been sampled and tested, which is the time the person interfaces with us, we are dealing with what is unknown. And the likelihood of being compromised or contacting the disease is higher when it has not been clearly defined. When it is defined, the status is known, and I'm approaching the person, I put on the requisite PPE. But for us, because of our training, we are prepared to treat every person as a suspect.
All right, Doctor, I'd like to ask you many more questions, but we've run out of time and we'll have to stop there. But thank you for that update.
It's a pleasure being here.
Thank you for joining us.
Thank you very much. And we'll commend the President of the Federal Republic for what he has done so far. He has shown demonstrable political will at dealing with this pandemic.
Thank you, Doctor.
Thank you.
Now, Kemi Akinwande is standing by in Ibadan with more reports. We'll join Ibadan later. Now we'll be joining Professor Wale Suleiman via Skype to give us more updates on COVID-19. Hello, Professor.
Hello, good evening. How are you doing today?
Thank you for joining us via Skype. Sadly, there's been a death from COVID-19 in Kwara State. Now, can you tell us about the efforts to trace those who have been in contact with the index case and his wife?
Well, the connection is poor, but thank you for the opportunity to connect with you via the NTA station. I've been enjoying your program. So just a point of clarification, the individual that died in Kwara State was never confirmed to have COVID-19 because he was never tested. But because of his travel history, because he had exhibited some symptoms that may have been consistent with COVID-19, and the fact that we found that his wife who is one of the two patients that now have COVID-19 tested positive. So we can assume that he was positive, but he was never tested, so he's not a confirmed COVID-19 death.
So what are you doing to allay the fears of the people, and what are you doing to increase the level of awareness?
So as you may know, the Kwara State it's really been ahead of a lot of states in terms of preparedness for COVID-19. We finished our isolation center months before we even talked. Everybody was talking about COVID-19. We have now created about 1,000 bed capacity to make sure we can take care of all levels of patients that may need care, either for quarantine, for observation, oxygen therapy, or even critical care. We formed a very robust and active COVID-19 committee, and one of which is the public awareness and education. And they've been going around talking, engaging in playing jingles on radio interviews, TV interviews, just like what I'm doing now. We've made some pamphlets, posters. We've also engaged the traditional rulers and community leaders to make sure that people are aware of this disease. The basic message of you don't go to any social gathering. We actually shut down any, we stopped all any form of social gathering, either religious or and that's gone a long way, but we need to continue to do more, especially now that we have cases in Kwara State. The patients that have been confirmed to be positive, they are now in our isolation center. They're doing well, they're not symptomatic, and we're just making sure that once we get 2 subsequent tests that are negative, they will be able to release them back to their families.
So tell us a bit more about the isolation center in terms of equipment and preparedness.
So thank you for that question. As I was saying, the isolation center was actually built months before COVID-19 became an issue. It's a state-of-the-art isolation center that now we're using at the highest level of care for patients that may have COVID-19. So we have ICU type bed there. We have we have a couple of ventilators that are being equipped, that are being installed now. We have patient monitors. All the equipment that you'll find in their intensive care, with the exception of the shortage of ventilators, we have them there. But besides that, we also have, like I said earlier, about 1,000 bed capacity. So we converted one of our hospitals into a COVID-19 hospital, which is a sub-specialist hospital. In that hospital, there's about 350 bed capacity, where we can put 3 types of patients. Those that need intensive care, they can go to the ICU, with the 10 to 15 bed ICU. Those that need to come into the hospital to be observed, they will go to one of the 2 blocks. And then those that need oxygen therapy, we also have oxygen with them. And in addition to that, we're renovating our camp to create a 600 bed capacity in case we need to isolate more people that cannot do self-isolation at home, given their living condition.
All right, Professor, in light of the poor connection, I'm going to have to stop there. So thank you very much for giving us insights. Thank you very much. And now we'll join Kemi Akinwande in Ibadan for more reports.
Najatu and welcome to Ibadan. Thousands of households who benefited from the monthly conditional cash transfer of the federal government have been urged to use the money for pressing needs that can cushion the effect of COVID-19 on the economy. Dayo Gushala, who monitored the payments in Ibadan, takes it up from here.
For the benefiting households in Oyo State put at 13,806, this kind of intervention cannot come at a better time than now, as it's a test of the federal government's goodwill. Gathered in their tents, not unmindful of the social distance requirement to contain further spread of coronavirus pandemic, the beneficiaries, including aged men, women, and physically challenged, described the intervention as a novelty brought to relieve the poor.
We use the money for small trade, and a lot of profits is being realized for our daily needs. We need to thank the government for coming to our aid. This is because we did not work for them. Government is only being considerate.
Oyo State Commissioner for Women Affairs, joined by the head of the State Cash Transfer Unit to monitor the exercise, urged the officials in charge to be accountable.
The money being given to beneficiary or the people collecting it actually gets to them, and that we have seen. But we appeal to them that they should make judicious use of it.
By the end of the whole exercise, they will not get back to the former position where they were before the exercise started.
Additional cash transfer to the vulnerable is one of the social intervention programs championed by the federal government to alleviate the suffering of the poor. In Ibadan, Dayo Munshola, NTA News.
Oyo and Osun State governments enforced restriction of movement into their states to curb the spread of COVID-19. Larry Milei was at Ashijire, boundary between the two states, and brought back this report.
At the border between Oyo and Osun, was restricted as directed by the Osun State government to flatten the curve of the spread of coronavirus pandemic. The security agents did not take any chances. Vehicles were vetted on the spot. The ones carrying essential goods such as food, drugs, and other essential needs were allowed to move on, while others, without genuine reasons, were turned back.
The police, they cover the roads, so not allowed to go Abuja. I don't know why. He said the coronavirus.
I'm here 1 and 2 hours now. They don't let me enter inside. I don't enter inside town. I'm going straight.
For the communities around the border between Oyo and Osun State, one of their economic mainstay is selling of smoked fish and meats. COVID-19 has brought changes to their sanitary inclinations, but not to their purse, they claimed.
Since coronavirus happened all over the world and Nigeria, so there's no market at all.
Osun State government had imposed restriction of movement in and out of the state as part of efforts to curb the spread of COVID-19, while Oyo State imposed dusk to dawn curfew in its efforts at containment. In Ibadan, Larry Bilayi, NTA News.
And that does it from here. Najatu, it's back to you.
Thank you, Kemi. And we have another guest joining us via Skype in the person of Governor Aminu Bello Masari of Katsina State. Thank you for joining us, Your Excellency.
Thank you very much.
Now, in light of the recent death of a person suspected to have COVID-19, apart from sealing the doctor's clinic, what other measures is the government of Katsina State putting in place to curtail COVID-19?
I think what we are doing now is that we are identifying all the people he contacted, and so that we test them. We carry out the sample for testing at CDC Center in Abuja. And we have also provided food and other items for those that are being quarantined. We are not only sealing, but we are also restricting movements of all those that have been identified have contacted him before his death. And we are going through the records of his clinic to make sure that all those that he saw when he came back to Dora were identified. Some live in Jigawa State and some even in Niger Republic. So our medical team are on ground yesterday and working together with also the medical team from Jigawa to make sure that all those that he saw are identified and are kept away. Pending the results we are expecting to receive from CDC Center about the samples taken from some of the people that have been identified as immediate contacts.
So now there's a suspected case in Matazu. What's happening there now in this regard?
No, I think somebody reported sick when he returned from Lagos last week. And his samples have been taken to CDC. And until CDC brings out the result, well, we can say he's a suspect. That's why we have confined him to his compound and also confined those people who are looking after him to the compound so that if he proves positive, we will be able to contain the situation within his locality.
And in terms of creating awareness, increased awareness and compliance from the people, how prepared is Katsina State to deal with the scourge of COVID-19?
I think we are very much prepared. We had formed 3 committees, and all these committees are watching day and night to make sure that we deal with the situations. All suspected people coming into Katsina. You know, we closed our border over 10 days ago. However, we allow those who are indigenous of Katsina State to come in because we cannot turn them back. But what we do at the border, we have health officials that take their temperature, their names, their addresses, their villages, and telephone numbers if they have, so that we'll be able to liaise with traditional institutions to confine these people for the next 14 days to make sure that they are safe to freely mingle with the people. And Committee of Enlightenment, we have Committee of the Ulamas, we have Committee of the Christian community. All they have gone around in the Traders Association, the road transport workers. We have mobilized almost every associations and religious groups to go around all the 30 local governments to make sure that there is enough sensitization. And we are providing also facilities, soap and water for washing hands in and out of various mosques in the streets, and also some churches.
Finally, Governor, has the NCDC team arrived Katsina to investigate the suspected case?
No, normally they don't come. We send in samples, and we have sent in samples to CDC Center in Abuja, and we're expecting the results. Our team are on ground, ready, and they have the equipment and the technical staff to carry out samples. I think what we are short of is the test kits and other some essentials that we need from CDC to make sure that we meet the daily demand of those who want to be tested or those whom we are suspecting that they need to be tested for the safety of the public.
Thank you very much for that insight. That was Governor Aminu Bello Masari of Katsina State on the situation of COVID-19 there. And now we'll join Abubakar in Maiduguri for more updates.
Thank you, Najatu, and it's good to join us here in Maiduguri. In a bid to complement government's effort in strengthening awareness and prevention against coronavirus pandemic, Police Community Relations Committee, PCRC, has donated hand-washing facilities to Borno State Police Command. Pauline Kujevana has more details.
Police, as government agency responsible for the enforcement of laws, are exposed to hazard in the course of discharging their duties. Hence, the awareness campaign for proper hygiene and the need to maintain physical distancing with colleagues and offenders as preventive measures against coronavirus. Chairman PCRC Borno State, Sanda Sharif, said, considering the relationship with the police command to enhancing security of lives and property in the communities, provision of the hand-washing facilities to control and prevent the spread of the disease became imperative.
Who arrests the offenders is the police. You don't know where they're coming from. You don't know whether they are carrying this virus with them. So it's a threat to public safety.
Commissioner of Police Aliyu Indasu re-echoed police culture of discipline in enforcing law and order and pledged to adhere to the basic rules and regulation of COVID-19, just as he urged PCRC in other states to emulate Borno.
The Inspector General of Police has won the sensitivity of this virus, and we here in Borno, we are in full compliance.
The PCRC pledged to strengthen awareness in maintaining physical distancing and hand washing with soap and water as preventive measures against the dreaded disease. In Maiduguri, Pauline Kujevana, NTA News.
You're watching Nationwide. Let's now return to Najatu in Abuja for more on Nationwide. Good evening to you.
Good evening, Abubakar, and thank you. And that concludes the news on NTA Nationwide. Thanks for watching. See you next time.
Emeka.